everybody. Welcome. Thanks for joining us today. I think we'll just give it another minute or so for people to come in. And while we're waiting to get started, I'd love to just hear from everyone in the chat where you're joining us from. If you want to just let us know. I'm here in the San Francisco Bay Area. So let me know in the chat, where are you all signing in from today? Bay Area from Ilar. We've got SF. Kirtana's from New Jersey. So welcome. So I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist. I'm the founder of Pacific Integrative Psychiatry. We're an online psychiatric practice in California, and we provide integrative psychiatry services and nutrition. And so I'm just really excited today to join, to welcome Josh. Thank you, Josh, for joining us today. And so Josh is our psychiatric nurse practitioner, and he's going to be talking today about supplements for anxiety. And this session is live and it's interactive. So if you have questions that come up along the way, please drop them in the chat. If you want to share any experiences that you've had with supplements for anxiety, please feel free to share that in the chat as well. And so we'll go ahead and get started. And just a quick disclaimer, the information that we're presenting in today's talk is information only. It's not medical advice. So if you have questions about your own specific situation, what you should be taking, please direct those questions to your healthcare practitioner. But we're going to be just sharing some general information about supplements for anxiety that hopefully will be helpful and maybe even serve as a jumping off point for you to have a conversation with your healthcare practitioners. So let's go ahead and welcome Josh. Thanks, Josh, for joining us. And before we kind of go into the content, can you share a bit about your background?
Yeah, hi. Thank you for having me. Thanks everyone for coming. I am a board certified psychiatric nurse practitioner. I'm really excited to have joined Pacific Integrative Psychiatry recently. I have a passion for root cause, figuring out like why any given person is having certain symptoms, whether it be anxiety or anything else. There are a number of reasons why people might be feeling anxious or depressed or irritable, not being able to sleep. I look for things like micronutrient deficiencies, gut dysbiosis, chronic infections, inflammation. All these can contribute. So my passion for using a more holistic approach to psychiatry led me to pursue training in integrative and functional psychiatry. So I've done the Integrative Psychiatry Institute's fellowship program, and then also finishing up a program called Psychiatry Redefined, which was founded by James Greenblatt, who's kind of a pioneer in the field.
Fantastic. And so I know I'm really excited to hear from Josh today, because I know you're really knowledgeable about integrative and holistic therapies and supplements. So we're not going to go into the details of what is anxiety today. We were thinking of talking about that, but I think that could be a whole session in itself. So if anyone is interested in another future workshop on learning about what is anxiety, how to identify it, and how to know if treatment is warranted, just let us know in the chat if that would be of interest. So we won't go into all the symptoms, but when it comes to anxiety, there are lots of different treatment options. There's medications, there's therapy, there's behavioral and lifestyle interventions. There's lots of different things that can be done, and this includes dietary supplements. So I know Josh has a few to share with us. So let's maybe get started with the first one. What is one of the dietary supplements that you would recommend for anxiety?
Yeah, there are a lot, but for sake of time, we're going to talk about 4 or 5 today. So magnesium is probably my favorite, and I'm sure a lot of you have heard about magnesium. And aside from being really helpful for anxiety and a lot of worries, it can also help for promoting good quality sleep, helping with muscle aches, energy production, blood sugar balance. So it's really helpful for all of these things. And actually, recent statistics show that up to half of Americans might be deficient in magnesium. So I've used magnesium with a lot of patients I've treated. The forms I tend to like are glycinate, threonate, taurate, citrate, kind of depending on the particular constellation of symptoms someone's having. And research shows that magnesium is helpful kind of via a number of different mechanisms. It does increase levels of GABA in the brain, which is our primary inhibitory neurotransmitter. So it can help with like feelings of calm and relaxation. And it also can help by modulating the HPA axis, or the hypothalamic pituitary axis. And that's kind of the seat of our stress response. And also just really good at reducing inflammation. So yeah, I love magnesium.
Yeah, I think magnesium is a great option because, as you said, about half of the adult population in the US, maybe even up to 70%, are deficient in magnesium. And it's such a vital nutrient for synthesis of neurotransmitters, like you said, like GABA, and also melatonin, which is helpful for sleep. And you mentioned a few of the different types. And I see Christina's asking, can you repeat the types again?
Yeah.
So could you repeat those and maybe share a little bit about what are the differences? Like, when should you consider one over the other?
Yeah, good question. So glycinate is probably my favorite. It just tends to work really well for everything I mentioned, like anxiety, sleep, muscle aches. It's really bioavailable. These are kind of all compared to oxide, which is the form you'll find in a lot of supplements from like a Target or a CVS or a Walgreens. So glycinate is really good. I would say threonate is kind of a newer form of magnesium, and it tends to be helpful for, it really readily crosses the blood-brain barrier, which not all like chelated magnesiums can. And so for things like brain fog or migraines, the threonate can be really helpful. Citrate is one thing that we can run into with magnesium. If you take too much, you might have like gastrointestinal side effects. So things like loose stools. And so for some people who are really constipated, citrate can actually be a good option because it is bioavailable, but it does tend to move things along in that way. And then taurate actually is a great form of magnesium for the heart. So I didn't get into this, but magnesium has been used in different arrhythmias like AFib. It can also help lower blood pressure. And so taurate is a really good form for that. There are others, there's malate, there's aspartate, but these are really the ones I like. There's actually a specific supplement, it's called Ultra Mag, and that one has a combination of some of these really bioavailable forms. So yeah.
Great. That's super helpful. And yeah, I like how you put that in. Like when I'm talking to a patient about magnesium, one of the first things I ask is about their bowel movements, because that's going to help us determine what form would be best for them. And yeah, so if they have diarrhea, then citrate might not be the best form. Maybe glycinate or threonate would be better. And I see another question from Christine. Is there a specific level or dosage? I know it should be gradual, but curious how much.
Mm-hmm. Yeah, I mean, I usually start low and titrate up. So I might start at 150, maybe 200 milligrams, usually at bedtime, just because it does tend to really help with sleep quality. And so, yeah, and then, I've gone up to 600, 800 milligrams a day. Usually at that point, it might be in divided doses. So, you might take 400 milligrams in the morning. But you do want to work your way up kind of slowly if you're going to get to a dose that high, because there can be GI side effects.
I think that's a good rule of thumb, to start low and go slow with anything that you're starting, whether it's a supplement or even a prescription medication in some cases. And another really important thing to remember about that is, just because something is natural, quote unquote natural, it doesn't mean that it's safe. And it doesn't mean that it's safe for you. And So you mentioned some of the GI issues that can happen with magnesium. Is there anything else people should take into account, like any other reason not to take it or to be cautious?
Good question. I like magnesium for most people, and again, just most of us are deficient. The only other kind of time where I might be cautious or definitely start with a low dose and not go too high is if someone has like renal impairment, so issues with their kidneys, because then you might have a little bit more trouble, getting rid of the minerals. But yeah, and then any, interactions with other meds. I don't know so much for magnesium. Yeah, I really haven't seen that. That's a good question, though.
Yeah, great question from Christine. Lots of great questions from Christine. And if anyone else has questions, please feel free to drop those in the chat. So excellent. Yeah, and not a ton of drug interactions with magnesium. Usually, like as you said, pretty well tolerated, unless of course there's kidney disease or other health issues. So again, conversations to have with your healthcare practitioners. Great. Shall we move on to the next one? What would you like to share next?
Yeah, so we'll talk about it's an oral form of lavender, so it's called Selexin. It's a really pretty cool supplement because there's a lot of times for supplements, no one is funding this research, so there might not be as robust of like a literature base as we'd hope. There's just not money in that research. So Selexin has been studied pretty extensively over the past 5-10 years for generalized anxiety. And so one thing I will, just bring up now, this is different than like having an essential oil that you might use topically or that you might use a diffuser for. You don't want to take that orally. This is a very specifically like formulated oral form. So the mechanism of Selexin is actually not completely elucidated at this point. It is thought to modulate serotonin levels and also moderately inhibit voltage-gated calcium channels. So that's actually how some other medications that we use for anxiety, like Lyrica, work. So there have been some good studies that actually look at Selexin head-to-head against other really conventional treatments that we use. There was a study that looked at it against Paxil or paroxetine, which is an SSRI antidepressant, and another that looked at it head-to-head against Ativan, so lorazepam. And actually in both studies, Selexin was found to be pretty much equivalent. And as you can imagine, the side effect profile was much better, so obviously, there are a lot of potential risks to long-term use of benzodiazepines, and then antidepressants can, not always, but come with their own set of possible side effects. So Selexin is actually really well tolerated. Rarely someone will tell me that they have, well, actually, this is not rare. People will tell me that they get like lavender burps in the same way that someone might have like indigestion with fish oil. So a fun hack is putting Selexin in the freezer, and that can actually help mitigate that side effect.
Yeah, it's funny with the lavender burps. I actually have some patients who like that flavor. So, some people actually might enjoy it, especially like these days you can get like lavender cappuccinos and things. So for some people, it's actually a desirable effect. But that's a great hack with putting it in the freezer if you don't like that aftertaste. And it's amazing the data that's coming out on Selexin and how effective it can really be. And I've seen it work well with my patients who have anxiety and insomnia. They can find it quite calming. I know there's hormonal effects with lavender as well. Could you share a little bit about that?
Yeah. So I think this is an area that needs some more study. It is thought to possibly weakly act on estrogen receptors. And so for that reason, it still kind of definitely needs some more study to validate those concerns. But for that reason, anyone who's had a history of estrogen, based cancers, definitely, talk to oncology first, talk to your oncologist and make sure that they kind of give you the go ahead. Similarly, just because there is that potential hormonal effect, I don't, tend to recommend this in, prepubescent or, like people who are going through puberty. We just have too many other options that don't have any risk at all. So, yeah.
That's a good reminder. Yeah, so definitely the hormone sensitive cancers, especially like breast cancer. So just to be really mindful with the estrogenic effects of lavender. And with kids, I've actually seen, I had a patient who had a daughter who was, I think she was maybe 7 or 8 years old. They weren't using Silexin oral capsules, but they were using a lot of lavender-based products. So like skincare products and bath oils and things like that. Like kids products with lavender. And she ended up going into or like early puberty, early onset puberty. And it was thought to be from the lavender. So again, just because something is natural, it doesn't mean it's safe. So use caution. But Silexin is a great option for people who are able to, manage those effects where it's appropriate. And so really helpful for anxiety and for sleep. Any questions about Silexin, feel free to drop them in the chat there. Otherwise, we'll move on to the next supplement.
All right, we'll look out for those. Next, I want to talk a little bit about L-theanine. It's a really interesting non-protein amino acid. You've probably heard about it in green tea, that gets talked about a lot. It's been shown to be effective for reducing levels of anxiety, also improving cognitive function and sleep quality. It's thought that L-theanine works by enhancing alpha brainwaves, which can kind of help us feel a sense of calm alertness. So it's actually used pretty regularly in ADHD as well. It increases the synthesis of neurotransmitters like GABA, which I talked about, which can help with feeling calm and relaxed, and also dopamine and serotonin, which, we hear a lot about the conventional antidepressants working on serotonin, dopamine, norepinephrine, and they can help improve our general sense of well-being. So unlike, benzodiazepines or other anti-anxiety treatments, it doesn't lead to sedation, sleepiness. And so a lot of people like taking that even twice a day, find that it helps their level of concentration. Yeah, so I've had a lot of good luck with L-theanine.
Yeah, I agree. L-theanine is a really great option, again, for anxiety, like you said, and for focus and attention. And it's interesting because it's one of the only compounds that helps with focus, or helps with being calm without being sedating, and it helps with focus without being stimulating. So it's a really nice kind of option, and it can be taken at any time of the day. Are there specific ways that you like to dose it, or you like to space it out throughout the day?
Yeah, I mean, I guess it depends on why I'm using it. Some people really find it helpful for sleep, and in that case, I will just recommend that they take it in the evening. But often I'm using it for, kind of more generalized anxiety, and like I said, ADHD. So I'll often recommend that patients take it either twice or even 3 times a day. The dose for that, that can be anywhere from 200 milligrams twice a day up to, I've had people take 400 milligrams 3 times a day with really positive effect. And I don't know about you, but I really haven't seen any side effects. At worst, like any treatment, some people haven't responded to it or found it to be particularly helpful, but I haven't seen side effects.
Yeah, it's really well tolerated. And what I have found is, for people who don't notice an effect, it's usually because it's underdosed. So yeah, we can go up to those doses of like 400 milligrams 3 times a day. In some cases, I use L-theanine a lot as well in my practice, and I have had a few patients have side effects. Some of my patients have found it just too sedating. And so they just couldn't tolerate it. I had a patient very recently, actually, where we had to stop it because he was developing headaches on it, but extremely rare. It's like very, very rare that I'll hear of side effects. So this is a nice, well-tolerated option for a lot of people. Ilar is asking a question, which I think is really interesting because we're seeing L-theanine a lot nowadays in different supplements and different food products. So she's asking, what are your thoughts on caffeinated products and beverages that contain L-theanine for people with anxiety?
Yeah, that's a great question. The L-theanine in like green tea, for example, which is not not an herbal tea, so it does have some caffeine. I have found that people who struggle with anxiety are able to tolerate the caffeinated tea much more because it is balanced out with the L-theanine. Not always the case with coffee, which doesn't have that to balance it out. Interestingly, I have had some people who are just not willing to give up coffee, not willing to move to decaf, and they actually found that L-theanine really kind of helped with the jitters or exacerbation of anxiety that would come with coffee.
I've seen that too with some of my folks where they'll add or they'll take an L-theanine supplement with their coffee. One thing I'll add to this is that with a lot of these beverages that you'll see on the market, we might not know what doses of L-theanine are in them, or it might only have like 30 milligrams or 50 milligrams of L-theanine. So they're not those therapeutic doses that we were talking about where we might be prescribing 200 milligrams plus. So there could be some benefit, but probably not so much for anxiety, but maybe just reducing the jitters from any caffeine in those drinks. And now there's a lot of other drinks coming out with like L-theanine and ashwagandha, which is the next supplement we're going to talk about. So again, feel free to drop any questions about L-theanine in the chat, and then we'll hear from Josh about ashwagandha.
Yeah. So I love ashwagandha. Has kind of a funny name, but it's one of my favorite supplements for anxiety. Arguably one of the best studied too. So it's considered to be an adaptogenic herb from Ayurveda, which is one of the oldest forms of traditional medicine. I think the main way that it acts is by modulating that HPA axis that I talked about earlier. So the hypothalamic pituitary adrenal axis. It can reduce cortisol, which is, like I also mentioned, our main stress hormone. Cortisol gets a bad rap. It serves a very important purpose in the body, actually many functions, but with chronic stress, we can have too much cortisol, and ashwagandha is really effective at bringing that down. It's also really anti-inflammatory. It supports thyroid function, sleep quality, and overall metabolic health. It's a really potent antioxidant. Another thing kind of similar to L-theanine is, even though it's really helpful for anxiety, it's not super sedating. So I often will have people take ashwagandha twice a day. And people actually, there are studies that show that it can enhance cognition. Yeah, so I recommend ashwagandha all the time. I've even gotten some of my very conventional psychiatrist friends to start using it themselves and recommend it all the time. So yeah, I love ashwagandha.
Yeah, I mean, it really is like, one of the oldest anxiety remedies that we know of, and it's very effective. And are there any side effects that people should look out for with ashwagandha?
Some people can have GI upset, probably like almost any medication or supplement. Again, people who are maybe a little bit more sensitive might have a little bit of sedation with it. I don't see that often. I can think of one thing. Some people maybe who are doing an autoimmune paleo diet, and they're sensitive to nightshades. Ashwagandha would actually be something they would want to avoid. But yeah, I haven't seen too many other side effects. How about you?
Yeah, similar. So yeah, pretty well tolerated. Sometimes you'll see some sedation. yeah, some GI upset as well. There is some data showing that it can affect, I think it was hormone-sensitive prostate cancer. So again, for anyone who has a history of medical issues, of course, talk to your doctor before starting this or any other supplement. Yeah, and I think it's thought to increase testosterone levels as well. But as you were saying before, these things aren't studied the way that medications are studied. So many of these reports come out later. One thing I'll also add, and then also Christina's asking what's the therapeutic dose, if you want to speak to that in a moment. But I'll also add that with ashwagandha or any adaptogen, which helps your body adapt to stress, they take a long time to start working. Like you probably won't see effects for probably 2 months, like 8 weeks of treatment, whereas something like L-theanine can work pretty much right away. Like sometimes people will notice an immediate effect an hour after taking it. But could you share a little bit about dosing?
Yeah, so there's a bit of a range. 300 would be the minimum therapeutic dose that I use. And then, I mean, I've used up to 2,000 milligrams per day in divided doses. I would probably start somewhere around 300 to 500 milligrams and then work up. Difference between capsule and powder. Frankly, I'm just more familiar with using capsules. They're usually, a good product will be standardized to, I think, 2.5% with analytes, which is the active compound in ashwagandha. But I mean, the powders can be fine too. I know less about them personally. I know a lot of people get the powder and put them in smoothies. Again, I don't think, especially with that range in dosing, I don't think you'd be overdoing it by adding a little bit to a smoothie if you're taking a supplement.
Great. Yeah. Great questions. All right. And in the interest of time, I think we can move on to our final supplement today.
Yeah. So the last one is vitamin B6. So all of the B vitamins, to be fair, are really important for having like healthy levels of stress and bringing down a lot of anxiety. But B6 is particularly impressive. There are a lot of reasons why someone might be low in B6. Something like being on oral contraceptives, those have been shown to actually deplete certain nutrients, and vitamin B6 is one of them. Also, any kind of digestive disorder like inflammatory bowel disorder, irritable bowel syndrome, celiac disease, SIBO, those can all impair digestion and also absorption of certain nutrients, and B6 would be included. It's a really important cofactor in so many biochemical reactions in the body. I've talked about GABA a couple of times today, and B6 is really a cofactor in the synthesis of GABA. It's also a cofactor in the synthesis of serotonin. And we know a lot about how serotonin is important for, regulating mood, anxiety, stress response, as well as sleep. So, yeah, vitamin B6, there's even very recent data looking at B6 for both anxiety and depression, and it's very positive.
Yeah, and it really kind of brings us back to that root cause approach, right? Like helping the body, like fueling the body with all the building blocks that it needs to make the neurotransmitters involved in mood regulation, like serotonin, dopamine, GABA, and so forth. With B6, are there any side effects to look out for?
Yeah, there can be. The one that it's gotten kind of notorious for is kind of interesting. High doses of vitamin B6 over a long period of time can cause peripheral neuropathy. So it might be like numbness, tingling in extremities. The interesting thing is there's also data that vitamin B6 can help with peripheral neuropathy in the context of diabetes and otherwise. So it's definitely something you want to watch for and monitor for, especially if we're using doses above, probably 50 to 100. I don't know that there's a lot of data that the risk is with any doses under 100. And then you can also very likely mitigate that by using the active form of B6, which is P5P, as opposed to the regular form, which is pyridoxine.
Great. Super helpful. Thanks, Josh. And I know we're just on the top of the hour here, but there's a couple of other points that we'll touch on. And so if anyone needs to drop off, we'll send you the recording. But I think these are important points for us to kind of cover. So we're going to talk about how do you choose a good quality supplement, and then what to ask your physician if you're interested in using any of these supplements or other ones for anxiety. So let's talk about how you choose a good quality supplement.
Yeah, it's a good question. And I guess get asked this all the time. It's kind of the Wild West out in the world of supplements. It can be really hard to tell if what you're looking at on Amazon or Vitacost or iHerb is a really good quality supplement. There's some things I like to look for. I like to see that it's been third-party tested for purity. That looks at whether or not there are any contaminants like heavy metals in the product. Also, kind of a good thing to look for is a GMP certification, and that's good manufacturing practices. It's a very specific certification that it tells you that it's a pretty good product. Getting into certain specific products like fish oils, where we really worry about rancidity of those polyunsaturated fats. There are specific fish oil third-party certifications. So I look for those. We at Pacific Integrative Psychiatry, we use Fullscript, which is really great because they kind of do all the work for me and they do the work for you. They vet out like the really high quality supplement companies. And so, yeah, you can just be more confident that you're getting what the label's actually saying.
Great. I think that's really important. And the other thing I like about Fullscript is that they store their supplements at the appropriate temperature. And even when that's where I buy my own supplements from too. And so when they send them to you, they're packaged in the appropriate type of packaging to regulate temperature and stuff. So I think that's really helpful too. So you don't get degradation of the supplement. Great. And then what should people ask their healthcare practitioners if they're interested in trying a supplement?
Yeah. I mean, some of these questions have been asked today, which is great. You're ahead of me, but you want to know why you're taking a supplement. I can't tell you how many times I've met with someone maybe for the first time and they tell me they're taking 10, 15 supplements and they really don't know why. So really just having a clear picture of, for this supplement, what's our goal? Another related question is how long, until I know that this is working. So kind of like you mentioned, Dr. Bhopal, something like ashwagandha, I tell people we're playing the long game a little bit here. It's going to possibly take up to a couple months to really feel the effect. Whereas something like an L-theanine or even like a vitamin B12, you do know much quicker. How long do I have to take it? You might be really just replenishing in the context of a deficiency, or it might just be something foundational that you are going to be taking more long term. And then with or without food, that's kind of a question whether it's a medication or a supplement. Some supplements are really absorbed much more efficiently on an empty stomach, and I think of certain amino acids. And then others you actually do want to take it with food. So something like a vitamin D or an omega-3 supplement that you want to take with a meal with fat for the best absorption. And then interactions, that's a great question. Yeah.
Right. So asking if there are any drug interactions to look out for. Yeah, that's important. And I think that's especially important because I see that a lot with patients where they'll start taking something and they might not even tell me or tell their healthcare practitioner that, I started taking rhodiola or something like this, which can have a lot of interactions with psych meds. And so it's really helpful to have that conversation with your practitioner. I'll just add one more thing just about supplements in general, which is that supplements are a supplement, meaning they're not a replacement for healthy diet or a diet that's appropriate for your personal needs, for lifestyle that is appropriate for your personal needs, for good sleep, and all of these things, right? So you don't want to just be taking a whole, cabinet of supplements, but then eating, crap food and not getting enough sleep and not taking care of yourself in other ways. But they can be a really, really useful adjunct to a treatment plan, and sometimes can replace medications in some cases. That's something we specialize in here. So, Josh, if people want to work with you, or if they have patients they want to send you, how does that work?
Yeah. So I see patients all over California. We're doing telehealth right now, so super convenient. Currently accepting new clients. If you want more information, if you wanted to set up a discovery call with our team to see if I'd be a good fit, you can go to pacificintegrativepsych.com. And I'd love to work with you. Really passionate about using an integrative approach.
Excellent. Well, thank you so much. And I think we did pretty good on time, so just a few minutes over. Thanks, Josh. That was really great. So much useful information. And I think this is one of those talks that people might want to listen to more than once to go back and pick up all the detail, because you've shared a lot of great information today. So if anyone has suggestions for future workshops, other topics you want to learn about, feel free to email us. You can email us at contact@pacificintegrativepsych.com, and Kirtana has dropped that in the chat there. Or just put it in the chat now if you have ideas. Next week, we've got Ilar's workshop. Ilar's actually on the call here. Ilar, if you want to just talk about your workshop next week, since you're here, that would be great. So she's going to be sharing about food for winter depression, and I'll let Ilar share a bit more about that.
Hi. So my name is Ilar. I'm the functional nutritionist at Pacific Integrative Psychiatry. And next Wednesday, actually, I'll be hosting a workshop, and we'll talk about how different types of nutrients affect our mental health. So the role of the gut-brain connection and the gut-brain axis. And we'll talk about specifically the winter blues, types of symptoms associated with it, what types of foods can help improve your mood and increase your mood. And if you're interested in signing up for the workshop, you can find the link on our website. You can follow us on our Instagram page, LinkedIn. We have the links posted everywhere. And if you can't make it to the workshop at the time, just like this workshop, it will be recorded, and we'll send you the full recording afterwards.
Fantastic. All right, great. Well, thank you so much, Josh. Thank you, Ilar. And thanks everyone for attending today. Have a good day.
Thank you.